Good morning, everybody. We're going to begin our panel. My name is Carl Corder. I'm a professor here at OISE and the Dr. Eric Jackman Institute of Child Study and a faculty member in the Atkinson Center. It's my pleasure to facilitate this panel this morning with some people who are going to tell us about building minds for collaboration. And I'm going to introduce them in the order in which they're going to speak, and then they can make their way to the front and talk to you about their ideas on building minds for collaboration. And we're going to unpack what that means, but part of the function of their talking now is to share some ideas that they'll be talking about in more depth this afternoon as a bit of a tease, and if you're not able to get to their particular workshop, you'll be able to hear some general outlines of what they're talking about. So when I read Building Minds for Collaboration, I thought, that's a clever title, but I wonder what it means, and are there other ways we could phrase that? For example, could it be sharing minds for collaboration, or could it be changing minds for collaboration, or could it be making up minds for collaboration? But I think I like building minds for collaboration because it hints at an active construction that people are working on together, so I like that. So congratulations on a good title. I think we're off to a good start. I wanted to share something with you that I heard yesterday afternoon. I had the pleasure of visiting with Fraser Mustard, and he said the following to me in a way that only he can say it, so my rendition will be a very pale version of what he said. But he said something like, "The future of humankind depends on our ability to develop shared understanding." So he was talking about shared understanding among people, among politicians, among academics, about how we deal with the great problems that we face and will face into the future. And of course, as you know, he believes that society's ability to develop high-level shared understanding depends on early childhood, and not just on the brain and neurobiology, but on the environment and the social environment that wraps around developing children. So his charge to all of us is to develop the capacity among children, among ourselves, for shared understanding. So I think that's what we're beginning with in this panel discussion. I think in this case, we're talking about shared understanding between sectors. In some sense, we have people here representing care, health, education, academia and research, family support, and we're trying to talk together across boundaries that are long-standing, that are sometimes problematic. So that's a form of shared understanding. We're also talking about shared understanding at the professional level, where individual professionals from different backgrounds with different personalities come together and become teams which drive forward, making the worlds of children and families better. We're also talking about the very important shared minds and understanding between families, parents, and professionals. And I think that's a huge issue that we don't really know how to handle that well in terms of our thinking about service delivery and new ways of moving forward. And of course, we believe that shared understanding, sharing minds for collaboration that we do as adults has to build shared minds among children, because they're going to be the citizens of the future. So that's my attempt to provide sort of an interpretation of the title that we're looking at, but I'm going to call on the panelists who are the real experts in thinking about these issues. Our first panelist will be Jenny, whom you've met, the Atkinson Chair here at Boise UT, and a noted scientist as well as a clinician and somebody who thinks a lot about children and families. Our next speaker will be Jeanette Peltier, who is the director of the Dr. Eric Jackman Institute of Child Study and my favorite early childhood educator, because she is also my partner. We're moving on then to hear from Sue Macon, who is Healthy Families Director for Toronto Public Health. So Sue is actually out in the in the Toronto public health system, making things better, thinking about programs for families and children, and doing very important down in the trenches work. And last but not least is Patricia Chorney-Rubin, who is Director of Community Services and Early Childhood at George Brown College, and an inspirational leader not only in the training of early childhood educators that goes on at George Brown, but in terms of making George Brown College a really important community contributor to the people who are collaborating around work on behalf of families and young children. So that's the order in which they'll come up. I'll call on them to come up in just a minute, but just to tell you about what will happen, each of them will speak quite briefly, 5-7 minutes, if I can manage them. I don't know, they look pretty unruly to me. And then we'll have time for a discussion following their presentations. And then we'll move to a lunch break after that discussion. And I just want to announce that during the lunch break, there are student posters somewhere at the back around the corner in which students have reported on some of their investigations into the following topics: the developmental progression of rational number understanding using the number line. So we just heard about math earlier this morning. Young children's understanding of rational numbers. Let's unwind. What's on your mind? This sounds like something to do with mindfulness, if I'm not mistaken. Can we work together? Preliminary findings from examination of ECE and teacher dynamics in full-day early learning kindergarten classrooms. Externalizing behaviors in children in care, the role of child welfare workers and foster families. And finally, ecological determinants of school readiness, a longitudinal study. So I'm going to turn it over to Jenny now, and our panelists will just come up in order and talk about building minds for collaboration.
So, whoops. Yeah. It's a very different height that I am from Carl. Okay, so my question is, how do we provide individuals for the skills of collaboration? I really think about this as relationship building, about relationship capacity, about how we get into one another's minds, why we get into one another's minds, and what the importance of that is. So it's about building the space between minds, and we see it from very early on in development. We see the capacity of children altering their own behavior to do a joint action with another person, and we see that from 18 months of age. Okay, so they're really geared to think about how can we do this thing together that is going to do more than one of us can do on our own. And that's the real element of collaboration that I think is critical. So arguably, and someone called Mike Tomasello has written a lot about this, arguably that's the basis of creativity and culture. And you can see the little kids doing a joint action together, a creative joint action together. Okay, now I'm going to talk about brain size. Why? I'll tell you in just a second, but you will get the point for why this is why I'm mentioning this. So our brain size is a function of the size of the social group in which we live. So the square at the top are us, and the size of our neocortex has developed over our evolutionary history, and along with that is the number of people that we can relate to relate to. So what this guy, Robin Dunbar, has argued and has shown is that brain size has developed in order to take account, to be able to think about a large number of people, so that I have you in my mind. That's what I'm thinking about. So our group size is around 100, 150, and we can think about what these people are like up to that number of people and how I can interact with them. So why is this important? Why do we need such big brains? And the reason is that we need it for gossip. And Robin Dunbar has shown this, that if you go to a restaurant or you go to a cafeteria and you just sit there and you listen to what people are saying, about 70% of what people are saying is about other people and how to understand them, how to understand their intentions, their thoughts, their motivations, their experiences. That's what we talk about with one another. That's what's important to us. And that's the basis, I think, of our social understanding and of our collaboration. Caregiving, it turns out that caregiving influences, as you all know extremely well because you do it day to day with the children that you work with. So caregiving influences that support aspects of these development. And I think we've really got two things that we're talking about when we talk about what's important in collaboration. One is mental architecture. One is giving children the vocabulary, the words that they need to engage with this, the concepts, the structures that they need in order to be able to think about working and being with other people. But they also need the motivation. So we also need, it's not just vocabulary, it's not just internal state language, which gives them a way of saying, I'm upset, I'm angry. It's wanting to do it with another person, and that's where the motivation comes in. So it's motivation, a pro-social motivation towards other people. I want to talk to this person, I want to be engaged with them, I want to problem solve whatever problem we've got together. So I'm going to talk about some data later, not now. I'm just going to give you just a bottom line now, but it comes from a study where we've been following up 500 families from newborn. We've also looked at we've got the older siblings in the study, and we're following them over time. And a thanks to Sue Macon and Donalda, who's somewhere in the audience, who facilitated us getting the sample from Toronto together. It's a big resource on early development, and we have lots of data on kids at school from birth up to school entry and what makes a difference. So if any of you need this in any way, if these are data that can speak to issues that you have, talk to me about it, because we have many collaborations going on with people using these data in different ways. So what are all the components that we're talking about? We're talking about empathy, we're talking about cooperation, we're talking about children's understanding of themselves, which takes place at around 18 months. We're talking about gaze following, being able to look at something that somebody else is pointing to. How does a little kid get to that point where they know what it is that you are trying to direct their attention to? we're talking about receptive language. In the older years, we're talking about children's understanding of other minds and their knowledge that your belief can be different from my belief. We can hold two different beliefs simultaneously, and then how we negotiate that in that space between minds. The caregiving that's important, that we've shown to be important, is things like the sensitivity of the caregiver, how much the caregiver can get into the experience and be directed by the child's experience. So I loved what Ellen was talking to you about before, about how we as teachers have goals for children, but we also get inside what children are interested in order to meet those goals. And that's part of sensitivity, caregiving sensitivity. So we get inside kids and what they're thinking about. Scaffolding is a similar idea where you're trying to push children to the next level, but you're doing that very close to what they know now, and you're building on that. You're challenging them cognitively. Reflective functioning is an interesting one, where we're looking at people's capacity to think about themselves and the people that they relate to. So their ability to use their experience to think about that experience and then to change things about it because they can think about it. And there are individual differences in that ability. And mind-mindedness is really, again, how much do caregivers talk and think about minds? And that's things like, do they use mind words? Are they thinking, oh, sweetie, you're thinking about this, or you're wanting that? That's about minds. Thinking and wanting is about what's inside a mind. The motivation aspect is also sensitivity, we find again, and then we also find this critical issue of fairness. And that's about negotiating in a family. When we think about that, it's two children feeling like they're getting the same thing. But we know kids in families can't get the same thing. One kid's sent to bed at 10 o'clock and one kid's sent to bed at 7 o'clock. It's different because of age. So it turns out that it's about how parents present fairness to children. And you're presenting fairness on a daily basis to kids. And Jan will talk a little bit about how we can do about experiences of fairness between people who are working together and how leaders can negotiate that sense of fairness. And that's it for me. So I will pass on to Jan.
Sorry, I thought all these were together. So let me just move down to, how many slides did you have, Jenny? Oh. There we are. It's great to be here. And I imagine some of you have figured out already that the panelists up here are the same people who are leading workshops this afternoon. And in fact, Jenny and I will be presenting in a workshop this afternoon and hoping to engage those who come to this workshop in discussions about building minds. Thanks. I guess I know how to do that. I just forgot. Okay, so there are many ways to conceive of shared minds. There are multiple shared minds in our everyday lives, our work lives, our personal lives, in relationships that we have, in policy and in practice. And I've listed some of them here: professionals and parents together, getting inside each other's minds, professionals with each other, and here I'm talking about the new team, the integrated early learning team. Parents and children, Jenny talked about that. Professionals and children, Jenny referred to that too when she was talking about caregivers. There's also children and children, and I think I would refer you to those Theory of Mind posters that are going to be at the back during break. Under all of this, I like Bronfenbrenner's theoretical framework, Many of you know Bronfenbrenner's work ad nauseum, particularly if you are our students. But this work really discusses overlapping spheres of influence. You can't discuss a child without thinking about the child's family or the child's early learning environment. You can't discuss parents without thinking about the environment that parents live in. So it's a great theoretical model. So as you can see, the arrow here indicates the two collaborations that I'm going to be talking about now and in this workshop this afternoon. So my focus on collaborative minds is collaboration that informs policy and practice in children's programs. And to bring that to life, I'm going to be referring to family literacy programs. That's just one example of a program that allows practitioners and parents to get inside each other's minds around the topic of literacy. It's just a great concrete example. There are many others. And I'm just going to pause for a moment to address Steve's talk this morning when he was saying that effect sizes don't often last, right? But I feel, and I've seen, that when we collaborate deeply with parents and we engage parents to the extent that they have the same kind of knowledge that we have about children's development, and I'm talking about literacy here, we may see long-term effects. The effects may not dissipate over time because we've actually made a huge change in parents' thinking about children and their literacy. The second example I'm going to talk about is from the full-day early learning kindergarten research that I'm doing. Carl mentioned Ainsley's poster, which is really about the staff team. We're getting early findings now about that very staff team. I'll be talking about earlier staff teams from the Toronto First Duty model and Peel Best Start, how staff teams came together, what does it take to make it successful, what does it take, and how are we going to help our new professional teams. So the questions are, how do professionals, so that's ECEs, teachers, program facilitators, parenting workers, build shared minds with our parents, the parents of the kids we work with? And then how do professionals, and I'm only going to refer to ECEs and kindergarten teachers here, but it absolutely includes others, build shared minds with each other for collaboration. So the example that I'm going to discuss this afternoon is for educators collaborating with parents, are what are the processes? And I thought it was great this morning that our speakers did begin to unpack what goes on in programs that actually make a difference. And so I'm going to talk about what goes on inside programs with parents. Like, what is it that we share with parents that actually causes a change in their understanding and in our understanding as professionals? So what are the processes? It's not just about giving them take-home bags, or not just about, just about home visits. It is a shared relationship that is key. And so I'll be talking about those components. How do we create that shared meeting of minds? So as just a little teaser of what is shared is practitioners share information. So as a researcher, I would share information with practitioners about what really works in children's literacy development. What is it that young children need to know in order to become literate? What is the role of oral language? It's so critical. So that is my job, to share that with professionals. And practitioners, professionals, share that information with parents about oral language and print-based language development. But it's not enough for me or you to share this with parents. Parents need to share with us. They need to tell us about their own experiences, because everything we tell them gets mapped onto something they already know, and they internalize it in this way. So it's not simply a transmission of information. Plus, parents learn from each other. It's often about, how did you do that? Like, how did you get your child to talk about this at the dinner table. So they have great ideas that they share with each other. And then it's important, and I'll share examples of how parents and then their children develop a shared base of understanding about aspects of early literacy development. So we begin with informed and trained facilitators, and I see that I have a role there to help in the training of new professionals. And Steve and Ellen talked this morning about the importance of good programs, tested programs. So the program that I'm going to be talking about is one that contains many shared parts. There's a parent-child together session with the facilitator. So we've got all those minds together. And then breakout sessions in which parents and the facilitators are alone, so that the facilitators can discuss key messages that probably little children wouldn't be interested in, but at a level that parents can understand. And at the same time, there are child-only sessions in which facilitators are practicing those very concepts, the same things they're talking to parents about, but they're doing it in a way that children can understand. And then they all come back together so that children, parents, and facilitators are all sharing this knowledge, new knowledge that they have. This is how the meetings of minds can happen. And it's also important to have parents not just let it go, but to think about this, to keep this in mind over time. And this is what I think will make the difference in why effects won't dissipate over time, when parents really change their understanding. So what we want to talk about this afternoon is what is being shared. And now the second part is that I want to discuss this now is educators collaborating with each other. So again, what are the processes that make educator collaborations effective? It's not just about putting them together, although we have some evidence that being together is very helpful. They need to be together. They need to develop the relationship. So it's partly being together, but it's not only just being together. How do they develop shared minds? So the example that I'm going to be talking about this afternoon is from the Integrated Full-Day Early Learning Kindergarten research, and we've been looking at the impact of this program on staff teams, on parents, and on children, but today I'm only going to be talking about the professionals, the staff team, and what's the story behind it. I'll be talking more in depth about what integration is. This is a visual model, a graphic, that moves from this idea of coexistence, where professionals may not even really know about each other, or maybe they do, but they're coexisting. That's it. To a move toward some kind of coordination or an awareness of the other, an awareness to different levels of collaboration in which now we're starting to share information. It becomes increasingly demonstrated in their practices, that they are starting to share minds to the point, which we saw in the Toronto First Duty Project, where in some cases they had a completely integrated approach to their early learning environment. So it's the difference between just sharing information and sharing minds. So this is what the research says from our previous work about what's required to share minds. You need a commitment to a shared vision of integration, of collaboration. You need that commitment, number one. You need leadership to help make it happen and to model it. You need time to be together to discuss it. You need shared professional development and support, and we'll be talking about that more this afternoon, as well as mentoring and professional respect. These are the 5 themes that have come out of the research. So this afternoon, we're going to build understanding of shared minds by looking in depth at the processes and supports that build shared minds, and we're going to put our minds to work to set future directions for all of us. Do you have a PowerPoint? Nope. Okay. I'm done. Thank you. Sorry.
Good morning, or I guess almost afternoon. So in light of the fact that it's about 5 to 12 and your stomachs are probably starting to grumble, I'm going to save my PowerPoint presentation and overheads for this afternoon, for those of you who come to my workshop. What I do want to just talk about is when I read the title of the panel, it was Building Minds for Collaboration. And my instinctual response was, well, that's just a no-brainer. I mean, of course we would do that. It's simple and straightforward, and we are absolutely going to do it. I then actually read the description here. I don't know if you've read the description here. It says, in early childhood research, policy, and practice, children and their families are at the core of our work. In order to understand how to better serve all families, panelists will address the connections between children's immediate environment and the factors that influence and improve interactions between children from birth to school age. And I'm thinking, okay, wait a minute, this is a little bit more complicated than I thought. Maybe collaboration is complex and theoretical and challenging. And what I hope to demonstrate is that, well, the science and the evidence is absolutely crucial for building a foundation. At some point, we have to just do it. And we have to move along. And I think the work that we did with Carl on the First Duty project is a great example of how at some point you turn all that evidence, all that amazing, fantastic evidence into practice, and then you turn the process of turning that into practice into research itself. And you learn as you go, as opposed to making it up as you go, which sometimes we're doing too. What I want to do is illustrate that point by talking about what I think is a really exciting and growing partnership that's developing between public health and early childhood education. Now, there have always been, probably since the notion of licensing daycares and childcares came into existence, a connection between public health and childcare and daycare. We're the ones who come in and make sure the sand is okay to eat. And we're the ones that make sure that there isn't too much bacteria and mold growing in the water table, those kinds of things. And we are definitely the go-to person when you've got 3 cases of measles. And you need concerns around outbreak management. Those are the things that you're familiar with, you're comfortable with, you know about how we connect. But those tend to often just be at an individual service provider level. We connect with you, we deal with the outbreak, or we deal with the dirty sand, or whatever it is, and we move to the next center. More recently, though, I think that partnership has matured, and we are starting to talk about other things. We're starting to talk more about nutrition and how important it is for tummies to be full in order for kids to learn, and what that means in terms of the kinds of food kids are eating. More recently, there was some work done around trans fat food and foods in childcares in Toronto. But even beyond that, thinking about the impact of children who are poor and living in poverty coming to school, coming to childcare with empty stomachs, or with no snacks, or with the possibility of no dinner when they get home at night. And so we are starting to build relationships and partnerships around nutrition and food. Injury prevention is another area. Certainly the areas around car seat safety, kids have to get to and from centers. How do we promote safety, both in the home and in facilities, whether they're schools or childcare centers? A more recent example is promoting physical activity and helping you understand how important your body image, your personal body image, is in terms of influencing the body image of the young children that you're working with. And we've done some work with a variety of connections around public health and early childhood education. In Toronto, in particular, Toronto Public Health happens to be the lead agency for preschool speech and language, and so we definitely see some incredible linkages and partnerships around preschool speech and language and communication development. And I think that there is so much more room for that relationship to continue to evolve and continue to develop. And it just makes good sense. We have the evidence to support that we do, but we also have some really practical reasons why we need to do it. Frankly, resources are tight. We can gain a lot of leverage by connecting and working together and maximizing our resources. And I think as, I'm not quite sure what word I want to use, but as the important role that public health and early childhood education plays in children's lives gains more credibility and more understanding, there are opportunities for us to connect. So those relationships I want to explore a little bit more. And I want to explore them on a variety of different levels. It's not just about how we connect over one child, and it's not just about how we connect in one center, but there are things we need to do to connect from a broader policy perspective and a systems perspective that will make the entire system better for children and better for families. And it's not just about the kids. So there's the relationship piece, there's the systems piece, and there is the family piece. And I know you've heard this morning a lot about how we can't think of them as just little children entities, but we have to think of the important role that family plays in working with children. Public health has a very significant mandate in working with children, and I think that the work that Charles Pascal has done has shifted the boundaries on that also, and we all look with bated breath for the new child and family framework that will be coming out from the province, and I think that there will be amazing opportunities for us to work together through that framework. So I'm actually going to shift the title a little bit from building minds for collaboration to building sectors for collaboration. And our two sectors are early childhood education and public health. Okay.
Hi. How many people have ever planned a conference? Anybody? Okay. So next time, you come up with the titles for the workshops. Because, I thought that one was pretty good. We spent a whole meeting, right, thinking about the titles. And so, and you can tell a good title when it gives a lot of room for interesting ideas to be discussed, right? So I think let's hear it for our title. So this afternoon, it's going to be my privilege to facilitate a workshop with 3 groups of talented early learning educators. We'll have a team from Appeal Public School, a kindergarten teacher and ECE who have been working together in a full-day early learning experience. We're going to have the team from Bruce, coming from the First 30 experience, who will be there this afternoon, and we will have a team from one of George Brown College's lab schools at our Ryerson kindergarten full-day experience. And so 3 groups of professionals will be sharing their experiences this past year and in other years about what the full-day learning has been for them in terms of their collaboration together. What have they brought together? What have they learned from one another? How has this collaboration with one another and with families benefited children? What works and what irks? So this afternoon, that's a good title. Yeah. Okay, parking lot that for next year. And so we'll benefit from hearing the lessons learned. In our programs at George Brown College, we, like many of you, have spent a lot of time thinking about what this means, and we could focus on a lot, and this afternoon we'll hear about the many pieces of collaboration. And I'm going to build on some of the things we just talked about around what we've been paying attention to in terms of our collaboration with parents and with families. And we have, like many of you, been well informed by the early learning framework, right? And like all of us in the room, we have committed to this notion of children and families are at the core of our work. And so as a result, we have been working and focusing on the relationship between our early childhood practitioners and our families. And ELECT has helped us to focus on a couple of key components to that. One that we're paying a lot of attention to is this notion of the continuity of learning that happens from home to the center within the center, room to room, and then the center to school. And Jen, you illuminated that idea as well. This notion of the continuity of learning, that's a big ask in early that elect has asked of us. And we've been giving some thought, a lot of thought to what that looks like on the daily drip of life between our practitioners and our families. We know that. Your research has talked about how powerful parents are in the lives of children in terms of their learning. And we know that important learning happens at home, right? And so we've been paying attention to that. We've been thinking about that in terms of our practice. Well, what does that mean in terms of our daily drip? How might those big ideas of this understanding that what happens in home is important and should influence what we do in the center? And we thought, well, what are some practices what could we change, right? What have we thought about? In our lab schools, we've thought about that in a very simple little idea that's taken off. We have put planning with families, right, on our planning sheets. Well, novel idea. We could have had a V8 on that. A family comes in, they share something important that happens at home. It's so important that we think about it deeply, and we write it down on our planning sheets, and we build on that. We had an example where a family talked about an experience they had on the weekend. They went, pumpkin picking at a pumpkin patch, and they were excited about that. The children were. We said, "Oh, really? Let's do more about that." We put it on the planning sheet. It got deeper and more fulsomely discussed, and it was elevated in its importance. We have paid attention to the other big ask that happens at ELECT, and that notion of the reciprocity of learning. And you talked about that, Jen, as well. The idea that parents have a lot to learn from us, early childhood educators and kindergarten teachers. We have a lot to learn from parents. We are learning about opening the door wider and respecting that we can learn from one another. And we've paid a significant amount of attention to that. A couple of years ago, Mikhail Perlman, you talked about the studies and work that you've done about interactions at the beginning of the day in some centers. And people paid a lot of attention to it. I think it was in the studies that your observations were that parents, ECEs, spent about 67 seconds at the beginning of the day. 63, oh, come on, I want those 4 seconds back. Engaging with families. And I think that caused many of us pause for thought. And we've thought about that. We could ask a lot of questions. What were they doing when they weren't talking to parents? They were doing important other things. But really, at the end of the day, from our perspective, how many seconds or minutes we have to talk to families in the morning isn't as important as what we're saying. What we're saying. Well, I'm going to tell you what we're saying more. ELECT has asked us, too, to pay attention to recording observations, learning stories about children's skills and what they're learning. And we spend time now with greater intentionality talking to families about what children are, the miracle of their developing skills. We share those stories, and families go, really? At home, they're doing that, too. Really? So we are paying attention to what it is we're saying with families and how that informs what we do in practice. So this afternoon, you'll hear more about that idea of how the partnerships of collaboration work with families and the other pieces that we talked about. So we've been very excited about this. I think it's a mindset. We've been very excited, it's another mind thing, about the mindset of working with families and how that's informing our practice. Thank you.